Every 34 seconds, someone dies from heart disease. Could you be at risk without even knowing it? Understanding heart disease, often referred to as cardiovascular disease, is one of the leading causes of death worldwide, yet many people do not fully understand what it is. In simple terms, heart disease is a broad category that includes several conditions affecting the heart and blood vessels. The most common type is coronary artery disease, which occurs when the blood vessels supplying the heart become narrowed or blocked due to plaque buildup. This reduces blood flow and oxygen to the heart, increasing the risk of a heart attack. Other types include arrhythmias, irregular heartbeats, heart failure, and congenital heart defects. What makes heart disease so dangerous is that it often develops silently over time, without obvious warning signs in the early stages. Lifestyle choices, such as an unhealthy diet, lack of exercise, smoking, and excessive stress, play a major role in its development. Additionally, conditions like high blood pressure, high cholesterol, and diabetes act as silent contributors, gradually damaging the cardiovascular system. Understanding the basics of heart disease is the first step in preventing it. By learning how it develops and spreads, individuals can make informed choices about their lifestyle and medical care. Prevention is always more effective than treatment, and awareness about heart health can significantly reduce the burden of this deadly condition. With global health experts continuously warning about the rising cases of heart disease, it is clear that greater education and early interventions are essential. Knowing how the heart functions and what causes it to fail can empower individuals to take control of their health before a crisis occurs. Symptoms of heart disease. The symptoms of heart disease can vary depending on the type and severity of the condition, but certain signs should never be ignored. One of the most common symptoms is chest pain or discomfort, often described as pressure, squeezing, or fullness in the chest. This may spread to the shoulders, arms, neck, or jaw, and is especially alarming if it occurs during physical activity or stress. Shortness of breath is another important symptom, as it indicates the heart is struggling to pump enough oxygen-rich blood throughout the body. Fatigue, dizziness, and fainting spells may also occur, particularly in cases of arrhythmia or heart failure. Swelling in the ankles, legs, or abdomen, known as edema, is a warning sign of fluid buildup due to poor heart function. Some individuals, especially women and older adults, may experience atypical symptoms like nausea, indigestion, or pain in the back and stomach, making heart disease harder to detect. Silent heart attacks are also a reality, where patients suffer significant heart damage without experiencing traditional chest pain. Recognizing these warning signs and acting quickly can save lives. Medical professionals emphasize that time is crucial during a heart attack or cardiac event. The faster an individual seeks medical care, the greater the chances of survival and reduced damage to the heart muscle. It is important to listen to your body and never dismiss unusual or persistent symptoms. Regular checkups and screenings can help detect underlying heart conditions before they manifest as severe health crises. Raising awareness about symptoms not only helps individuals, but also empowers families and communities to act swiftly in emergency situations. Risk factors for heart disease does not develop overnight. It is the result of multiple risk factors that build up over time. These risk factors can be categorized into two groups: controllable and uncontrollable. Controllable risk factors include lifestyle habits such as smoking, poor diet, physical inactivity, and excessive alcohol consumption. Smoking, for instance, damages the lining of blood vessels, accelerates plaque buildup, and increases blood pressure, making it one of the strongest predictors of heart disease. A diet high in saturated fats, trans fats, and sugar contributes to obesity, high cholesterol, and diabetes, all of which increase cardiovascular risk. On the other hand, uncontrollable risk factors include age, gender, genetics, and family history. Men are generally at higher risk earlier in life, while women's risk increases after menopause due to hormonal changes. A family history of heart disease significantly raises the likelihood of developing similar issues. In addition, stress, poor sleep, and chronic conditions such as hypertension and diabetes further amplify the risks. Modern lifestyles, dominated by fast food, sedentary jobs, and constant stress, create an environment where heart disease is more common than ever. Understanding these risks is essential because many of them can be managed or eliminated through conscious lifestyle changes. For instance, maintaining a balanced diet, exercising regularly, quitting smoking, and keeping blood pressure and cholesterol in check can dramatically lower the risk of developing heart disease. By identifying personal risk factors, individuals can take preventive steps early, long before symptoms appear. Awareness of these contributors helps people realize that while genetics and age may be beyond control, daily habits and choices hold tremendous power in shaping heart health. Prevention and safety measures. The good news about heart disease is that in most cases, it is preventable. Preventive measures revolve around adopting a heart-healthy lifestyle and being proactive about medical care. One of the most effective steps is maintaining a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like those found in nuts and fish. Reducing salt and sugar intake is crucial to control blood pressure and blood sugar levels. Physical activity is equally important. Engaging in at least 30 minutes of moderate exercise, such as walking, swimming, or cycling, 5 times a week can strengthen the heart and improve circulation. Quitting smoking is a life-saving decision, as tobacco is one of the leading causes of cardiovascular problems. Similarly, limiting alcohol consumption and managing stress through meditation, yoga, or deep breathing techniques can significantly improve heart health. Regular health screenings are essential for early detection of problems such as hypertension, high cholesterol, and diabetes. These conditions often go unnoticed until they cause serious damage. Doctors may recommend lifestyle adjustments, medications, or both, depending on an individual's health profile. Sleep should not be underestimated either. Studies show that poor sleep increases the risk of heart disease. Building supportive habits, such as regular bedtime routines, helps improve both heart and overall health. Importantly, communities and families can play a role by encouraging each other to stay active and eat well. Preventive healthcare is not just about avoiding illness, but about creating a long, healthy, and fulfilling life. Each small change in daily routine adds up to a significant reduction in heart disease risk, proving that prevention truly is the best medicine. Living safely with heart disease for individuals already diagnosed with heart disease, the journey does not end with treatment. It requires long-term management and lifestyle adjustments to stay safe and live well. The first step is following a doctor's treatment plan, which may include medications to control blood pressure, cholesterol, or heart rhythm, as well as procedures like angioplasty or bypass surgery. Adherence to prescribed medicines is vital, as skipping doses can worsen the condition or trigger emergencies. Lifestyle modifications are equally important. Patients must prioritize a nutritious diet, exercise regularly under medical guidance, and avoid harmful habits like smoking. Cardiac rehabilitation programs, often recommended after a heart attack or surgery, provide structured exercise, education, and counseling to help patients recover and reduce the chance of future complications. Emotional health also plays a major role. Living with heart disease can cause stress, anxiety, or depression, making mental well-being a crucial aspect of overall care. Support from family, friends, or patient groups helps individuals cope better with the challenges of managing heart disease. Monitoring symptoms closely and reporting changes to a healthcare provider ensures early intervention when problems arise. Even with heart disease, it is possible to live an active and fulfilling life by taking proactive steps and staying vigilant. Patients are encouraged to see their condition as a wake-up call rather than a limitation, adopting healthier habits that not only improve heart function but also enhance overall quality of life. With medical advancements, early detection, and consistent self-care, many people with heart disease live long and productive lives. The key is commitment, awareness, and the determination to stay safe every day.